Oh, there you go. I
There
think
it
that's
is.
gonna burn. We might have to put that one out.
I like it burned though.
You like it burn?
It's gotta be crunchy. There has to be a crunch to it. Oh man, I think I did it. I overdid it. It's okay, I'll still eat it.
So Amanda, I want to know a little bit more about, when you first became aware that you actually, you have this condition. I have atopic dermatitis, atopic eczema. Were there any things that just, made it really difficult throughout this whole treatment process for you?
Definitely. It was like solving a puzzle every single time. When I was going to the dermatologist, the many dermatologists that I went to, it was the same regimen.
Okay.
And I was hopeful because it was a new cream or a new ointment, but nothing really
Worked out.
Nothing was very long-term and safe and effective, and that was my issue.
Meeting all these doctors and dermatologists, what do you think was the hardest part? Was it like finding that connection with the right person, or that's maybe they just saw the disease but didn't really see the person?
That's a really great question because I feel like in retrospect, being so young, that didn't come across, that didn't have value for me. But now as an adult, that definitely has value for me. And I think that's part of the healing process and the journey, having someone on your side and having someone to listen to your voice and looking at you holistically as a whole person, not just the skin.
You talk about holistically, right? And I think that term means something very different, to every person, right? My opinion of it is that it basically means treating the patient as a whole, right? And it doesn't mean that we're moving away from what would be more conventional therapies, right? Using your creams or ointments, phototherapy, injectables, or medications that you take by mouth, by prescription, right? And not doing that and doing, things like just acupuncture or more integrative medicine. It's all of those things coming together, right?
Holistic to me is a practice, from mind, body type approach. Going back to this shared decision making, knowing my values, knowing that, what has value for me? Am I gonna do a regimen that I've been doing this whole time that has no value for me? Then I'm not gonna have faith that it's gonna work or it's gonna be ineffective, right?
Everyone is different and no treatment plan is the same. You mentioned in the beginning that stress is a trigger for you, right? And if we don't address that stress, how is that influencing the flare or what you're experiencing with your eczema? What I try to do for my patients is to try to get that approach, right? Try to get to know the person. The patient or the caregiver should feel that they should feel empowered, right? They should feel that they have a voice in this process because they are the ones that are having to struggle with the disease or take care of someone who's struggling with this. That's good.
I don't know, I can't do it. Okay, I'll just do this part.
There you go.